Thank you. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing. The territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. Tomorrow, Christmas Eve, there'll be a written statement at around 3 o'clock describing case numbers and other relevant information to COVID-19 in British Columbia. There won't be any briefings on Friday, Friday, Christmas Day, Saturday, Sunday, or Monday. Dr. Henry and I will be back here at in the Press Theatre on Tuesday, December the 29th, 8th. I'm getting signs, 28th, next Tuesday, in any event, at 3 o'clock. And with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you very much, and good afternoon. Today, we're going to present an update on where we are in the trajectory of our pandemic here in British Columbia and some of the data that we're using, and then we'll go through our usual report. So to start with, the epidemiology of what has happened in our pandemic and bring people up to date. This represents the geographic distribution of cases of COVID-19 by what we call the health service delivery area, so a larger health grouping, updated until the blue graph is the number of cases we've had since January, the cumulative geographic distribution, and the one on the right, the yellow and orange, includes the past 7 days. And as you can see, the progression of the pandemic really has been concentrated, or the largest number of cases have been concentrated in the Fraser region, with some, of course, increase in interior health and in the north. As the number of cases of COVID-19 have increased over the past number of weeks and months, we are now able to present data by local health area, and that is a more granular understanding of where cases have been. And I will remind people that this is our average daily rate per 100,000 population, and local health area represents the communities where people live who have tested positive for COVID-19. So that is our convention across the country, that we report by where people live. It may not reflect where they have been exposed to COVID-19, because we know that that can happen if people are traveling, if they've been to other places, if they work in different areas from where they live. But it does give you a good representation of the areas where we have the highest rates of COVID-19 in the province right now. This is an update of the data from the last week, from December 15th to 21st. We had 4,000, a little over 4,000 new cases that week, and then it was one of the most difficult weeks for us in that we had 109 people who died from COVID-19 in the week of December 15th to 21st. On the bottom of this graph, what you see is our epidemic curve with what we call the 7-day rolling or moving average. And that helps smooth out those daily case reports that we give every day and help us understand what the pattern of what pattern we're seeing in terms of numbers of cases and the trajectory over the weeks. As you can see, we did hit a peak around mid-November, and we've now started to slowly decrease. This is our epidemic curve, an update of the epidemic curve by reported date since January. So this is by the date that the test result is reported. And this breaks it down, and by the colors represent the different health authorities. Not surprisingly, what we can see is that Fraser Health Authority is where most of the cases live for COVID-19, particularly more recently, although we have also had substantial numbers of people infected with COVID-19 who live in the Vancouver Coastal Health Region, and more recently peaks in interior health and the north. The dotted line on the top represents, again, the 7-day rolling incidence of cases per million population, which again peaked in the middle of November and has now again started to drop. We've presented regularly on the likely source of infection by people's episode date, and by that we mean the day of their onset of illness. And this speaks to the public health investigations of every single case. Most of our cases continue to be directly linked to a known case or a cluster or an outbreak. And we've managed, even though we have struggled in some places, particularly in Fraser Health in the last number of weeks through November in particular, we do manage to get the vast majority, understand where the vast majority of people have been exposed, and the vast majority of those exposures are linked to cases that we know. So that's important for us. It means that we have not lost our ability to do contact tracing and to identify outbreaks as early as possible, although we have been delayed in some areas, certainly now in the north as well, where we're having challenges keeping up. This is an important representation as well of the pandemic since January and the impact on different age groups in British Columbia. What we can see is that the vast majority of cases, particularly in our second wave, are in people who are from 20 to 39 years of age. Those are the green lines at the top. But also, very importantly, we've been watching carefully the trajectory in school-age children, and that's represented in two different lines here on this graph. The blue line at the bottom, 0 to 9 years old, and the 10 to 19-year-olds in the darker blue, slightly higher up. As we can see that those still represent a smaller proportion of cases overall, and they follow the same trajectory that we have seen with everything else, lagged slightly. But also we see that when we put in the restrictions that we put in November, all age ranges came down, particularly important to follow those who are school-age children who also, we saw a decrease in incidence in those age groups. The next set of pictures tells about the daily case rate, so the number of people testing positive per million population, and the figure up on the top left is for all of British Columbia, and that reflects how we have been doing in terms of daily case rates and the percent who test positive. So the different colors represent the percent of tests that are positive. The gray figure in the background represents our testing rate. So this puts a whole lot of information into one graph. And what it tells us is that we had an increasing rate of testing, we had an increasing rate of positivity into November, and we've now started to see a decrease. And that has been particularly apparent in Fraser Health, in Interior Health, and in the North, where the rates still remain high. We've seen a decrease in Fraser Health, particularly in the recent weeks, as well as in Vancouver Coastal Health. And on the bottom right, and on Vancouver Island Health Authority, it has stayed very low, despite increased testing for the last few months. We've done the same thing to look at how the trajectory has moved by age. And we've broken it down so that we can isolate what is happening in school-age children as well. So there are two graphs that look at 5 to 12 years of age and 13 to 18 years of age. And the gray in the background shows us that we did a lot of testing in that age group, particularly as school restarted in September, October, and into November, and that our case rates remained very low. But as case rates in the community increased, we saw increases in those age groups as well. The other thing that's important to note in this is the 80-plus age group. And we know that people who are over the age of 80 are more likely to have severe illness or to die from COVID, and that is reflected in the testing that we see here and in the case rates here as well. In particular, many of the people who are over 80 are people, are seniors, are elders in long-term care, and the testing reflects the outbreaks that we've seen in the past few weeks in long-term care homes. Also very important that we've been following is our daily case rates, as well as hospital and ICU and deaths. And this is a reflection of the case rates in green with the markers of when we put in our most recent public health orders to try and decrease our social interactions. We saw a continued increase for the first 2 weeks, not surprisingly, after the orders were put in, as we know that many people in that group were already exposed. But what this does show us is that when we adhere to these orders, those case numbers do come down. And that is incredibly important for us to recognize. But we cannot let off. We've seen that happen before. If we look back into October, we were hovering along at 100 cases a day, and very quickly it spread rapidly. We're now leveling off in our hospitalizations, but they are at the highest level that we have seen this year. And tragically, our death rate has increased as well over the past few weeks. Another important marker that we follow very carefully is the age of the population and how the pandemic and the virus is affecting different age groups. The blue bars that we see in this figure represent the proportion of that age group in our population. So for under age 10, about 10% of our population in BC are children under the age of 10. The yellow bar next to that is the proportion of people who have COVID or have been diagnosed with COVID. And we can see it's about half of the population rate. We see a very similar thing, although slightly higher, in the 10 to 19 age group. But then if we look at 20 to 29, 30 to 39, again, it shows that cases are overly represented in those age groups. We also see that people who are more likely to have severe illness, to end up in hospital, in ICU, or to die from COVID are heavily skewed to the older age groups. We have had one person in the 30 to 39-year-old age group pass away from COVID, and 4 people 40 to 49. But really, the vast majority of people who have died from COVID have been 70 and older. Age remains the single most important risk factor for severe illness or death from COVID-19. And young people, children, are still underrepresented compared to their proportion in the population. These are things that we know are really important to help us understand the impact that going back to school has on the pandemic. And these are measures that we've been following. So most school-age children who have symptoms don't have COVID-19, and that remains the same as we have seen throughout the pandemic. With more than 600,000 students and educators back in our school system, this is something that we've been following very carefully. We have had many exposure events, and I'll show you some of that data in a minute, at our schools. And to remind people, an exposure event is when somebody who has COVID-19, who's been diagnosed with being infected with the virus, is in the school environment during the time when they could potentially be infectious to others. So we have been posting those regularly. It does not mean that anybody has transmitted the virus in those settings, but it's an understanding of how many people, how much risk we have in our school environment. And what we have seen is that even though we have exposure events that reflect transmission in our community, we have very little transmission actually in schools. School-aged children in the general population represent about 12% of our cases, and it has been fairly consistent, about 10 to 12% since the beginning of the pandemic. We have had 4 school outbreaks since the pandemic was declared, or since school returned in September. And just to put it in context, about 1 in 100 of school-aged children have been tested across British Columbia. And if we look at the general population, about 7% or 7 in 100 tests are positive. But if we look at the school-age population, that's much, much less. So even though 1% of school-age children have been tested, fewer than 7 in 1,000, or less than 1%, actually test positive for COVID-19. If we look at COVID-19 exposures, so not transmission, but exposures, we had 526 school exposures in just under 2,000 schools in British Columbia. That means that more than 7 in 10 schools have not had any people in the school when they've been potentially infectious to others. The vast majority of those, about 292, almost 300, have been elementary schools, and this includes both students and adults in the school system. And not surprisingly, the vast majority of our schools and the transmission, as we know, has been in the Lower Mainland, and the most exposures have also been in the Fraser Health Region and the Vancouver Coastal Health Region. We do have some updates, some detailed information from both Vancouver Coastal and from Fraser. And of the over 120,000 school-aged children, about 600 children or staff in the school system were diagnosed with COVID-19 and in Vancouver Coastal Health. So these are people who lived in Vancouver Coastal Health, but only less than 200 of those resulted in any exposure events in schools. So we know that people are getting exposed and getting sick with COVID in our communities, from social interactions, from attending events, from being in family gatherings, other gatherings, from many different situations in our community. And we know that very few of those go on to have even an exposure event in schools. And they had transmission in about 10% to 1 or 2 other people in the school setting. There have been no outbreaks in the Vancouver Coastal Health schools. So just to summarize, about almost 90% of cases, they acquired their infection outside of the school from primarily household contacts. Of cases in the schools, 2/3 of them were in students, 3/4 were in students, and 1/4 were in staff and adults in the school system. And for 90% of these exposure events, there was no transmission in the school. And most recently, with the investigations that we do in schools, most transmission events involve staff members to each other. As we know, adults are more likely to transmit this to each other. We have very similar data from schools in Fraser Health, where we have exposure events that have occurred in 384 schools. 1/3 of these were in the Surrey school district, and we know that there's the largest number of schools are in the Fraser Health region, and the Surrey school district is the largest of those. Out of 384 schools, there were 12%, so again, very similar to Vancouver Coastal, had potential in-school transmission events where there might have been transmission to 1 or 2 other peoples within the school. And about half of those transmission events were in Surrey School District. So, and most of those were secondary schools. So that gives us a little bit of an understanding of what's happening in terms of the risk in our school system in the last few weeks. Having said that, this is something that we have taken very seriously from the very beginning. The importance of children and educators being in the school system and having that in-class interaction is something that we know is important for the long-term growth and development of our children. So it is something we've paid a lot of attention to. And in November, when we started to have some challenges, particularly in the Fraser Health region, catching up with exposures and exposure events, I pulled together a task group to look at this in detail and to make sure that we were learning everything we could from what was happening in our school system in September, October, November, and this month. So that's being headed up by Dr. Reka Gustafson and includes members from the BC Teachers Federation, from our Ministry of Education, superintendents, parent advisory committees, and principals, others in our school system. And I know there's a lot of anxiety about transmission in schools, about exposures in schools. The data shows us that we are not seeing schools being a place where transmission spreads widely. And that tells us that when the safety protocols that are in place in schools are followed, it is a very safe environment, and transmission is very unlikely. But we know it is challenging. We know that kids don't always want to wear their masks, even when they're in the hallways. We know that the cohort system in some places works better than others. And we know that there's been challenges in the adults in the school system. How do we make sure that we have transition safely, that teachers who are working in multiple different cohorts are able to do that safely? So all of this is being looked at, and we're looking at all of the best advice that we can to support schools and the school community when we reopen again in January. So moving on about some of the comparators that we like to present around how we are doing compared to other places, are the trajectory of our pandemic. As you can see, we are still, although our second wave has increased, we have leveled off in terms of daily cases per million, our 7-day rolling average, and we remain lower than many of the other provinces in Canada. As everybody else has been experiencing as well, unfortunately, our death rates have come up in the second wave, and we know that we are not out of the woods in terms of our death rates, given the impact that we have right now in our long-term care homes. This is a comparison of our case rates, our 7-day rolling average compared to other countries, particularly the US and Washington State, UK, Germany, and a number of other countries. And again, comparison of, unfortunately, our death rate compared to other countries. The other thing that I think is important for us to update is the modeling that shows us some of the scenarios that we have been through and what we might be facing in the future. So firstly, the modeling of our estimate of the reproductive rate, or the reproductive number, RT. And this, as you know, is the number of contacts that we have where the virus can be transmitted. So it's a function of the number of people we're in contact with during an infectious period and the number of people who go on to subsequently develop illness. And 1 is kind of the cutoff. So when we're above 1, we know that the outbreak can grow. And it can grow very rapidly with even small increases. And we've seen that in the past few months. But once you're below 1, that means that on average, an individual who's infected does not pass it on to anyone or passes it on to one person or less. So that is where we are now. We have just come down slightly below 1, and we're hovering there, which means what we are doing is working, but we cannot let up. We've also been able, now that we have increased numbers of cases, we can understand how this trajectory is working in different regions of the province. And as you can see, across the province, we've started to slow down. We've started to put in place those measures that mean that we're reducing the number of people that we're potentially exposing with every person, with every new case. This doesn't mean, though, that it's easy. It doesn't mean that we're out of the woods. We know that the contact tracers are still working very hard, particularly in Fraser Health, Vancouver Coastal, and the north, where it's been very stressful and strained across the north. The other modeling that we look at is around the scenarios of where we've been and where we might be in the future. As you can see, we have bent our curve slightly, and we're now perhaps on a downward trajectory. We did reach up to 800 cases per day, but that has slowed, and we're now moving downwards. But the background blue tells us that we need to be cautious, because we can very easily, the scenarios that the model shows us is that it would not take much for us to get back into a danger zone again. We are probably right now, in terms of our infectious contact rate, somewhere between the 40 and 50%, given these model scenarios. So this gives us a sense of what could happen depending on our actions today and tomorrow and next week. So we can continue to bend our curve down to make sure that we're doing everything we can to prevent transmission right now, in particular, where we know we have vaccine that's starting to protect those who are most at risk. But it does not take much to tip us back over into the bottom scenarios, where this curve can once again rapidly take off. And just to end up our presentation today, I'd like to give a little bit of an update about what I just mentioned, the very positive fact that we have immunizations available to us now. So as of this morning, not only do we have the Pfizer-BioNTech vaccine, which has been approved for use in Canada, but Health Canada this morning also approved the Moderna vaccine for use in Canada and in British Columbia. And we have received word as of today that we will be receiving the Moderna vaccine next week here in BC, as will other provinces across the country. And that's important because the Moderna vaccine is more flexible in terms of the numbers of doses that can be broken down. It comes in boxes of 1,200 doses, but we can break it down into as small as 100 doses and take that out to different parts of our communities around the province. So that means we can start to address some of the urgent needs that we have to protect people in some of our remote and isolated, particularly First Nations communities, and also residents of long-term care home, where we know the virus is causing the most damage. So the second thing that we had good news of yesterday was that we can start to move the Pfizer vaccine away from the port of arrival. So we have tested and proved all of the transportation systems to the point of arrival and from there to administration. And we've now got the go-ahead from Pfizer to be able to move some of the frozen vaccine to other places. So again, we have the opportunity now with the Pfizer vaccine. It's still a bit more challenging because there's only a limited amount of time that it can be outside of the ultra-low temperature freezer. But that means we can also use the Pfizer vaccine to start immunizing residents of long-term care homes. So those are exciting things that have happened just in the last couple of days. And as well, yesterday we had confirmed from the National Operations Center the numbers of doses of both Pfizer and Moderna vaccine that we will be receiving during the month of January. So all of this is incredibly exciting. When I talked on Monday, none of that was known yet. And there are still many different scenarios that we were trying to plan to without knowing anything for certain. What we have done is prioritized who will get the limited amount of vaccines that we know we will be receiving in the coming weeks. And we've also made the decision based on looking at all of the data, the modeling from BC CDC, and discussions of the ethical framework, that we will be providing the second dose of both Moderna and the Pfizer vaccine around day 35. So the recommended from the company is around day 28. But we know we can immunize way more people in the first couple of weeks with their first dose of vaccine and provide that increased protection for people during this very critical time if we just slightly delay when people start getting their second dose. So for people who received the vaccine last week and this week and in the first weeks of January, you will be called back for your dose around day 35 from when you had your first dose. And this helps us in terms of understanding and protecting as many people as possible during this period of time where we are still seeing a lot of transmission in our communities. So the estimate numbers of doses that we will be receiving between now and March is about 792,000. And with the strategy that we have adopted, that will allow us to provide about 549,000 people with their first dose, with the protection that we get from that first dose, which is incredibly important. And about 240,000 people will also receive their second dose. So our priority populations in more detail for this first phase. So for December, the vaccine that came last week, this week, and next week, and to the end of January. So this is where we're focusing our attention right now. And that's on residents, now that we can move the vaccine more easily, and staff of long-term care, which is approximately 70,000 people, residents and staff of assisted living, People who are in hospital right now, which what we call alternative level of care, so people waiting a bed in long-term care, essential visitors who have been designated in those areas, and healthcare workers who are key to the COVID response and also to protecting our healthcare system. So our two main aims right now are to save lives by providing protection to those who are most at risk and taking the pressure off our healthcare system so that we're able to provide safe health services for everybody in the province through these very stressful next few months. And as well, we are aiming to protect people who, where if the virus gets into a remote and isolated community, it can cause a lot of damage and have very challenging times in terms of people being able to get health services, particularly as we're moving into winter. So we have identified, first off, 10 remote and isolated First Nations communities where vaccine will be sent to as soon as it arrives. After that, so this is going to be our sole focus for the rest of December and the month of January. As we get more vaccine and as we are able to protect populations, we'll be moving out from there to other priority populations, particularly people who are living in our community who are at risk, starting with seniors 80 and over, people who are experiencing homelessness using shelters and group homes. And we have seen that when this virus affects those communities, people are more likely to end up in hospital and to have severe illness and to put pressures on the healthcare system, our hospital system and our ICU. People who receive long-term home support, the rest of the hospital staff that are integral to our system, and additional people at risk in Indigenous communities. So that is our rather ambitious plan for the next few months. I'm excited and thankful and grateful that we have vaccines, and this is the start of our being able to protect people, particularly our seniors and elders who are so at risk in the coming months. And finally, I'm going to give you the update from today. So as of today, we had 518 additional new cases of COVID-19 identified in British Columbia, bringing our total number of people diagnosed with COVID-19 to 48,027. 97 of whom were in the Vancouver Coastal Health Region, 332 in the Fraser Health Region, 9 people in Vancouver Island, 49 people in Interior Health, 31 people in Northern Health Region. We now have 9,137 active cases across the province, 348 of whom are in hospital, 80 of those in critical care or ICU. We have about 9,689 people under active public health monitoring, although that does not include active monitoring in the north at the moment. As we mentioned on Monday, we're doing a data transition and we'll have more detailed information to catch up on next week. 36,952 people have recovered from COVID-19. Sadly, once again, we have far too many people who have died. We had 19 new deaths from COVID-19 in the past day, bringing the total number of people in our province to 796 who have died from COVID-19. Over the past day, families, our care providers, and communities have lost loved ones. Most of them are grandparents, our parents, aunties, sisters, and brothers. Many of them in long-term care, and a number in our acute care hospitals. We send our condolences to all of the families who are affected at this time of year, and we mourn with you and we feel your loss. We have 2 new healthcare outbreaks as well at the Evergreen Baptist Care Centre and Minaroo Residence, and 2 which are now over, including a large outbreak at the Felburn Care Centre. And we know how challenging that outbreak has been, and we want to do everything we can to make sure that never happens again, as well as the Villa Caratal. That leaves us again with 55 active outbreaks, 6 in acute care, in long-term care and assisted living, and 6 in acute care, affecting 1,414 residents to date. On a more positive note to date, as of yesterday, we have 5,603 people across British Columbia in every health region now who have received a COVID-19 vaccine, and myself included. Had the privilege of being with my colleagues and friends and the amazing public health team at Vancouver Island Health yesterday to show my support and my confidence in this vaccine across the province. And as I mentioned, we have another encouraging step forward in the Moderna vaccine being approved for use today. In the last month, as you know, our focus has been to encourage everyone in the province to reduce your in-person social interactions, and no more so than now as we head into these holiday weekends. The orders that we have in place support these efforts, and we are closely monitoring their progress, and I particularly want to draw people's attention to the order requirements for retail and vending markets, which has been adjusted to ensure that over the coming weekend, and Boxing Day is a day that I know many retailers have expect to have people coming in larger numbers than maybe in normal. I encourage people to stay local. Go and visit your local retailers and go in small numbers. But I also remind retailers of the need to ensure capacity limits meet the requirements of the orders, that one-way paths are followed, that barriers and mask requirements are being followed. If you are someone who cannot wear a mask, then phone ahead. Consider other ways of shopping on those days if you need to. And I will say that WorkSafe BC will be monitoring these activities over this holiday weekend. Additionally, as I've mentioned a number of times, we've had challenges in the north, and some of those challenges have been related to outbreaks that we've reported on in a number of the industrial work camps that are in the Northern Health region. We have been working with those large industrial camps and the employees that travel frequently to and from those camps. And as of today, I will be putting in a new order in place for industrial work camps in BC. And this order will require work camps to do a phased, slower startup in January. The original intention and the nature of these industrial work camps means that employees are frequently traveling to and from these work camps. And we know at the start of the year, the camps typically see an influx of employees returning to the site from BC, from around BC, but also from other places outside the province. This large movement of people means a much higher potential for spread, both amongst employees, but also into communities along the areas where the industrial camps are in the north. And right now, we know that Northern Health is stretched, both from a public health perspective, trying to manage and support communities where we have transmission, but also our health system, where there are a number of people both in hospital and ICU in the north. We are already seeing many small, rural, and remote communities in the north under strain, and the order that I will be giving will help to ease that pressure at the start of the year and ensure that our health system will be able to maintain the services that we need for everybody along the north. We have been in discussions with the major industrial projects now on how to make that happen, but that will happen so that we are not putting our communities at risk in January. As we know, the modeling has shown that the measures we are taking are work. I know the restrictions and the orders are difficult. But we also know that we have learned how to deal with this virus. And we have learned that when we take those measures, when we don't have gatherings, when we wash our hands, when we cover our mouth, when we wear our masks, when we stay home when we're ill, when we work from home now as much as possible, and when we are careful about following our COVID safety plans in all settings, we know we can reduce and stop transmission of this virus. With Christmas 2 days away, I remind everyone to keep your celebrations small, to avoid travel to other communities. Stay local, stay small. Show you care by staying apart and connecting with people in safe ways. We want our family, our loved ones to be there for the next celebration, for the holiday that we're going to have when we get this pandemic under control. The fewer people we see now, the safer we will all be. We need to show we care by staying physically apart and connecting virtually. This is a special time of year, I know, and having those connections with people we love and care for is important. So I encourage all of you to remind yourselves that we are in a very important place right now where we have vaccine and where we know the measures that we need to do to get us through this period together. You are a COVID-19 prevention expert. All of us are. And we know we can make it through this. We've come this far. Let's finish this year and start 2021 in the best possible place we can be. Following all of our orders, using your layers of protection, and staying close to home with those you live with. Allow us to do that. So together, let's make this a safe and happy holiday for all of us. And I want to again thank everybody for being part of this team that has got us this far, and to encourage you to remain strong and to remain kind and calm and be safe.
Thank you very much, Dr. Henry, and I wanted to start by acknowledging the 19 people who passed away in the last 24 hours from COVID-19, 16 in the Fraser Health Authority, 1 in Interior Health, 2 in the Vancouver Coastal Health Authority. It is December 23rd, and it's a hard time of year to suffer loss, I think, because it's often a time of year where we remember one another. And so I want to pass on our condolences. Those are the Premier, those are the government, those are the people of BC, to all those families, those friends, and those caregivers on their passing. 796 people have passed away since the beginning of the COVID-19 pandemic related to COVID-19. It is a massive loss for our province, for us, and we think of every one of those people and every one of those families and all of their friends, all of their caregivers, and all of their communities. It's been, and it is, of course, an extraordinarily challenging time for public health. As Dr. Henry has said, 9,137 active cases, 9,689 people under public health surveillance in the 4 health authorities that we have the numbers for at present, 348 people presently hospitalized, 80 in critical care. And all of that presents real challenges. One of the things that we prepared for in March and is reflected in our approach to the pandemic now is the hospital bed occupancy rates in our province. You'll recall the strong measures that we took in March to ensure that we had adequate acute care capacity based on what we had seen in Italy and in China and in other jurisdictions. As of December 22nd, last night, our base bed occupancy rate is 83.8% across the healthcare system, and nowhere is it above 90. The highest is in Vancouver Coastal Health at 88%. The lowest in the regional health authorities overall is in Northern Health at 76.6%. So that's the base bed occupancy rate. Those are the beds that are always available in our hospitals were before the pandemic. To put that in context, our situation is better in a sense than it is under a normal time this time of year. On December the 12th of 2019, for example, our occupancy was 103.5%. So we've obviously are organizing our hospitals in a way to manage a pandemic that is significant, 348 cases. We also have surge bed capacity. That's and so if you look at it right now, we have 1,518 vacant base beds, 2,551 vacant surge beds, and our total occupancy rate in all hospitals is 66%. In critical care, those numbers are 74.3% of base bed occupancy capacity, meaning 134 vacant critical care base beds, and we have further vacant, we have surge beds that are 245. So our total occupancy rate of base beds is 74% in critical care, and of all beds is 51.5%. I would note, because people are sometimes interested in the convention center, that beds in the convention center are not included in any of those numbers. So we are in a position to manage the situation, although it is extraordinarily stressful from a staffing perspective. And in individual cases of individual hospitals, I think of the extraordinary work being done at the University Hospital of Northern British Columbia right now. So we have that capacity. We have been doing a maximum amount of surgeries, more surgeries than our healthcare system has ever done before in the course of this pandemic. So there are ways to reduce activity should that be required. Right now, that is our situation, and our extraordinary teams in our acute care hospitals are doing a very good job of managing that situation. That's where we are, and that reflects, and sometimes when you hear different jurisdictions react on acute care capacity and critical care capacity, that's the difference in BC. Just to report on a couple of items that we regularly report on Thursday. Under our contact tracing initiative, we've now hired 1,275 people, which is above our target, which was 1,224. You know that originally we were going to add to our existing contact tracing capacity 500 positions. We've now added 1,275, of which 597 are in Fraser Health, 63 in Interior Health, 44 in Northern Health, 294 in Vancouver Coastal Health, 77 on Vancouver Island, and 200 in the Provincial Health Services Authority. A further 388 people, because we continue to add to this capacity, are in the interview or offer stage. As you'll also be aware, we have been hiring, we also report, I should say, on our surgical update, and this week I'm happy to report that 201,548 surgeries have been performed between May 18th, when we started our surgical renewal commitment, and today, of which 157,951 were urgent and non-urgent scheduled surgeries, sometimes called elective surgeries, and 3,597 were unscheduled or emergency surgeries. The week of December 7th to the 13th, we originally reported 6,747 surgeries completed. Now that the data has been verified and the full numbers are in place, we can say that that number was 7,178 surgeries between December 7th and 13th, which is 139 more surgeries than the same week last year, which itself was a record week. This week we were reporting that we've completed 6,704 surgeries, and it's anticipated that data verification will lead to higher estimates. And so I think that, in conclusion, I'd just like to underline two of the things that, and two of the slides that Dr. Henry has referred to on pages 25 and 26. And what they show is that we need, in response to COVID-19, and we have that, an absolute maximum response from our healthcare system, the teams at public health, the teams in the community, the teams in long-term care, the teams in our acute care hospital. But we also need to all be involved. The slide on page 26 in particular shows what happens when our infection contact rate rises. It means our number of cases rises significantly and can rise significantly. And that is part that all of us can be part of, and we need to reflect on this, I think, in this Christmas season, what we can do to reduce the spread of COVID-19, all while keeping in the spirit of the season. And we've talked about what that means in terms of socializing with our own household, and only our own household. Talked about what it means in terms of not going out and having gatherings in the communities, and there are orders in that regard. But it's also everything else. It's assessing the travel that we do and ensuring that we only do essential travel in these times. To reflect on all of our actions outside, to make sure that they meet the test of necessity in our lives, that we can all contribute to this by having less social interaction in person and more social interaction virtually. In other words, during this time, we have to reach out to more people in the ways that we can, while having less infectious contact, having less contact with people. That's what we need to do. That should be our goal this Christmas season. In closing, I want to thank everyone who's worked so hard this year and made so much sacrifice. I think of grocery workers and healthcare workers and people in the education system. I think of people in all walks of life who've contributed to our effort to deal with this extraordinary pandemic and this extraordinary year. It continues to be a remarkable effort, and points to a 2021 that will surely see faithful friends and family who are dear to us able to gather near to us again. Merry Christmas and happy holidays to everyone, a happy new year, and I hope that it brings all of us, safety, good health, and joy. And the way to get there is to do what we can to dig in and help one another right now, and to always, always, always be kind. Right, Dr. Henry? En français, aujourd'hui, nous annonçons 518 nouveaux cas qui ont testé positifs pour COVID-19, pour un total de 48 027 cas en Colombie-Britannique. Nous sommes attristés d'annoncer 19 nouveaux décès liés au COVID-19, pour un total de 796 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches durant cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 348 personnes sont actuellement hospitalisées, dont 80 en soins intensifs. Thank you very much. Merci beaucoup. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone, please press *1 to enter the queue. You are limited to one question and one follow-up. Please also take your phones off mute. You are not audible until your name is called. First question is from Matt Robinson, Vancouver Sun.
Matt has actually left the queue.
Well, thank you very much. Next question is from Rob Buffum, CTV.
Oh, hi. Thank you for taking my question. Dr. Henry, I'm wondering if you can just sort of react or spell out for us how meaningful this approval of the Moderna vaccine is. I've read that it's going to be described as sort of the workhorse vaccine relative to Pfizer because it's more mobile. How big of a breakthrough is this for British Columbians?
You know what? It is, as you say, something we've been hoping for some time, and we've been waiting for and planning for. So yes, it does allow us to move things. Both of these vaccines are very similar technology. They use messenger RNA, and we're learning a lot about how this technology, how stable it is when it's being moved around, and how stable the lipid nanoparticle is that's surrounding it, so that that gift wrapping, if you will, around the messenger RNA piece. And they're both slightly different and very similar. We know that they do travel well frozen, and we've proved that with the Pfizer vaccine. So with the Moderna vaccine, not only does it not have to be in a ultra-low temperature freezer, so we do have more -20 freezers around the province, but we can also store it for a longer period of time at fridge temperature, which is -2 to 8. And so that is really important. That allows us to get it out to many other places, and most importantly right now, to take it to some of our more remote communities, because we can also break it down, as I mentioned, to 100-dose aliquots. It comes in 10-dose vials. So that means we have a lot more flexibility. We can go into a community once and be able to immunize people and not waste any vaccine, because that's the other part that's so important right now when we have limited supplies. We also are now able to move the Pfizer vaccine, so particularly in some of our urban areas, we can move the Pfizer vaccine effectively, either frozen, and then be able to use it in several different places within the parameters of the time limit. So both of these things are really good news and make our life a little bit brighter on the horizon. So yes, it is. I think both of these things are incredibly important and things that we've been looking forward to, and the Moderna vaccine in particular, having the flexibility, and I just can't wait to get it out there.
Rob, do you have a follow-up?
I do. I'm wondering if you can give us a sense as to when on Vancouver Island specifically the Moderna vaccine will first be administered to folks here. And I'm thinking about, like, if you're able to give people in long-term care homes, if they're the first priority residents there, roughly when might a resident of a long-term care home on the island expect to get the Moderna vaccine?
Yeah, very good question. So we have limited doses that are coming into Canada next week, December 28th, and they will be going, the amount that we have in British Columbia, yet to be fully confirmed, but will be going to all areas of the province. So there will be some coming to Vancouver Island, and I know Vancouver Island Health Authority is working on identifying exactly which care homes will be targeted first. So my expectation is it will be sometime next week.
Pfizer can go to care homes as well.
Yeah. Yeah, and we are looking as well at when Pfizer can be taken into care homes around the province. With weather, with transport, with all of these things, I can't say what specific day, but we've been told by the NOC, it's called, the National Operations Center, around the vaccine supply, that we should expect both our Pfizer doses and Moderna doses starting as early as Monday the 28th.
Next question is from Jane Side, North Shore News.
Hi, Dr. Henry. I want to ask you some questions about the vaccination program as well. I've had some people ask, what about the long-term care residents who've already had COVID, either in the first wave of the pandemic in March or the second wave? Do they get the vaccine as well? And sort of where are they in the lineup? I'm just wondering if it matters if you've actually had COVID already.
That's a really good question, and we all ask that question too. So the short answer is we don't know how long immunity after infection lasts, but we do know it's probably for at least a few months. So somebody who had a confirmed infection in the first wave, absolutely would be first in line in long-term care, but this applies to people in the community as well. So yes, you can get the vaccine, and we recommend it for people even if they've had a lab-confirmed case of COVID. But if you are somebody who's had it recently, then we know you have some protection for a period of time. So you may not be the first priority in that case. But yes, it certainly doesn't have any negative effects. And what we believe it will do, knowing how other vaccines work, will boost that immune response that you got from the infection.
Jane, do you have a follow-up?
Yeah, also related to the vaccines, you mentioned the first dose and the second dose. If you've just got the first dose and you haven't gotten your second dose yet, do we know, what kind of immunity you might have, and what kind of program do we have sort of to ensure follow-ups and second doses, because that can sometimes be more of an issue, I guess, getting people in on time for their second dose.
Absolutely. Yeah, also really good questions. So we've looked at the data. It's just recently become available. So the National Advisory Committee on Immunization and Health Canada, of course, in approving the vaccines, had access to all of the study data from the large, there was about 44,000 people in the Pfizer study and similar numbers in the Moderna study. So in those studies, the data showed that people got either the vaccine or a placebo, and then they followed them out, and they got their second dose somewhere between, in both of these studies, it averaged around 28 days, but it ranged from, I think it was 20 to 45 days, so somewhere in there. And we followed people, and they followed everybody who got sick. And what we know from the Pfizer vaccine is that between the first dose and the second dose, the protection was at least 50%. But that included people who got sick even in the first week after receiving their first dose, which means that they may not have yet developed the antibodies from the vaccine. So if we look at just the people in the study between from 7 days or 14 days after getting their first dose, before they got their second dose, the protection was about 80%. And the same data for the Moderna vaccine shows, again, the protection's about 80%. And then after the second dose, that protection goes up to about 95%. So what that tells us is you get really good protection from the first dose, especially in the short term. What we don't know is how long that protection lasts. And that's what the second dose helps with, making sure it lasts longer. And the studies are still ongoing to see how long that will be. That's why we have made the decision to maximize the number of people who get that really good protection. 80% is more than we could hope for a lot of vaccines, to get that really good protection during this time when we know there's still a lot of COVID circulating in our communities. So we're optimizing that by stretching out a little bit when people are going to receive their start receiving their second dose. And as more vaccine becomes available, we'll be able to bring that back down again. But so we're looking at 35 days as how we're going to try and manage it over the next little while. And yes, we're putting in the systems, so every dose that people are receiving gets into our provincial registry, and that allows us to know when people are coming up for their second dose, and they will be notified. Right now, as you know, most people who are getting the vaccine are healthcare workers and people in long-term care, so we know exactly who they are and how to find them. But this will get more complicated as we move more vaccine into the community. So we are setting up these, what we call reminder recall systems, and we do have some in our health authorities that we use for childhood immunizations to bring children back at the time they need their doses, etc. But there is a lot of work going on right now to try and scale that up in a way that we can make sure we don't miss anybody. But right now, in some ways, it's good that we're starting slow because we're getting all of those processes worked out.
Nick Sweetman, CHLY. Nick, are you there? Okay, we're going to go to Tina Lovegreen, CBC.
Hello, thank you so much for taking my question. I was just going to ask Dr. Henry, some dentists in British Columbia are concerned that they haven't been mentioned yet for getting the vaccine. And, you know, they say they work with aerosols and they're at risk too. Where will dentists fall on the list of groups getting the vaccine, and when will that be decided? And also, can you clarify the recovered total? I think you said 32,963 today, and the dashboard yesterday said 36,094.
Okay, I have 36,952. And in terms of dentists, yes, I know there are many, many groups of people who want to know where they fall right now. And what I will tell you is we will know more about that when we have a better idea how much vaccine is available when. What we're focusing on right now is those priority groups with the limited amount of vaccine that we expect to have in the month of January, well, December and January. After that, we will be expanding groups, and we've talked about some of the priority populations, but as more vaccine is available, we will be expanding to others in the community. And we know the people who are most at risk are people by age and underlying conditions. And when we looked at all of the data in Canada, and other countries are doing the same, when we look at people who have heart disease, for example, or have kidney issues or have cancer, and we try and say who's most at risk, age is the most important factor. So we are looking at how we will go down in age groups. Probably the National Advisory Committee recommends 5 years increments as vaccine becomes available. And within those age groups, people who have underlying conditions and cancer and other things will hopefully be prioritized within those age groups. These are very challenging things because it's very difficult when we have lots of vaccine to try and figure out who needs to go first. But there are many other groups in our community, so other healthcare workers, other than the ones that have been identified in the first month. There are myriad other groups from dentists to physiotherapists to family physicians and others, as well as our essential workers from police and fire services and people who work in our food processing plants. All of those are people we need, and veterinarians. I think of dozens of others who have contacted me. It will become clear as we have a better understanding of what vaccines are available when. Right now, we have a limited amount of vaccine, and we're focusing on those we can protect who are most at risk. But absolutely, we'll be looking at how to do that in the future. But I will say, it is not likely to be until the end of March, April, when it's going to be more widely available for everybody. So everybody in those groups needs to think about that time frame. And that's really important because right now we still need to continue to do the things we know that work to prevent transmission of this virus.
Before we go to Tina's follow-up, I just want to remind everybody that Dr. Henry and Minister Dix will release a statement this afternoon with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. For updated province-wide restrictions, visit gov.bc.ca/COVID restrictions. And for information about the province's new orders and pandemic supports, visit gov.bc.ca/COVID-19. Tina, for your follow-up.
Yes, please. I was just hoping, Dr. Henry, if you could expand on the logistics of delivering the Moderna vaccine to remote First Nations communities, and also if we could please get an answer in French.
Yeah, the logistics are not my area of expertise. We have many people who are working on that. I can tell you that it is there are complexities, of course. So the vaccine, we've done some trial runs with the federal government about receiving it. It's not as challenging as the Pfizer vaccine in that it doesn't come in the same sort of shippers, but it does come directly to the areas, and we can send it to many more areas. So I think there's 20 different sites that we're looking at to start with the limited amount that we're getting in the first week of December. So it involves making sure we have the right equipment, the right people, the right security, the right processes in place, and there are a whole group of people, starting with our team at the BC CDC and Dr. Ross Brown in our operations center, and then in each health authority, who are putting all of those important pieces together. And I'll just say thank you, and have a happy Christmas and safe Christmas.
Oui, évidemment, c'est un défi, surtout dans les communautés les plus petites, des communautés autochtones dans la province. Cela étant, je pense que nous avons sélectionné déjà 10 communautés, et je pense que nous sommes en mesure de livrer les vaccins, c'est-à-dire les vaccins dans ces cas Moderna, à ces communautés-là. Ça va être un effort quand même difficile, mais absolument possible, et on est en train de préparer cet effort. Et je pense que les vaccins Pfizer sont plus flexibles. Il y a plus de flexibilité avec les vaccins Pfizer aussi maintenant, mais pour les communautés rurales, ça va être plutôt des vaccins Moderna qui vont être utilisés, mais on est prêt à le faire, et on va commencer avec les vaccins Moderna dès qu'il arrive, et je pense que ça va être la semaine prochaine. Et donc, j'apprécie les efforts de tout le monde, les gens du ministère de la Santé, dans les régies de santé, bien entendu le BCCDC qui travaille sur cet effort. Mais on a beaucoup de confiance dans notre capacité de faire cette mission. Vous avez entendu sans doute le Dr. Ross Brown, qui en a parlé il y a quelques semaines, et je pense que cela va donner beaucoup de confiance, surtout dans les communautés rurales, qui vont être tout à fait inclus dans tout ce qu'on fait pour protéger les gens de la Colombie-Britannique de COVID-19. Merci beaucoup. Joyeux Noël.
Happy holidays.